A lot of people get a lot of trigger points on the inside arch of the foot, so it's important that we kind of strip those out. Hey guys, Dr. Will here from Miami Spine and Performance. Most people don't know that some chiropractors don't only treat the spine, but we also treat other orthopedic injuries. In 2025, potentially the most common thing that I treated this year was foot pain, right? Typically plantar fasciitis. I see this a ton in, people that work jobs where they have to stand, or people that are playing pickleball, people that are playing tennis. What plantar fasciitis is it's really just when these muscles and fascia on the bottom of the foot get tight, it kind of contracts your foot in like this. And usually it's just chronic stress on the bottom of your foot, maybe not the best footwear, maybe ankle stiffness. There's a whole bunch of reasons, but I'll show you guys how we treat it today. So we already did our adjustment on the midfoot. So adjusting the foot, obviously a great way to help open things up, but we're gonna use our handy active release technique for our second treatment. So with active release technique, what I'm gonna do is I'm gonna shorten the foot up like this. This is gonna shorten the plantar fascia. And then I'm gonna take a contact and we're just going to lengthen. So active release technique is all about moving different layers of the muscle, right? So in the bottom of your foot, you have 5 layers. And so I'm pinning down some of the superficial layers and allowing the deep layers to slide. Plantar fasciitis sometimes because these layers kind of get glued together. So treatments like this can really, really help open things up, right? A lot of times I'll complement this with shockwave therapy, maybe some Graston and other things, but ART tends to work really, really well. Even if you're somebody that uses, a foot mat or use a lacrosse ball, there's not really anything that's like having somebody, who knows how to find the tissue working on the foot itself, right? And of course, it's not always the most comfortable thing at first, but it helps. If it helps you get back to work, get back on the pickleball court, most people are willing to take a little bit of discomfort to be pain-free while they're at work. Okay, now we'll check the other foot, same thing. We're gonna look at the bottom of your foot here. We're gonna shorten, find a nice knot, and stretch. Good. So like I said, a lot of people that come to my office have plantar fasciitis. Not just athletes, but just regular people that get it through work or whatever the case may be. There's a lot of other tools we use, but one of the most simple ways to fix plantar fasciitis really quickly, good adjustment, good active release technique. Maybe some rehab exercises as well. Okay, just like that. Now we'll work on the inside arch of the foot. A lot of people get a lot of trigger points on the inside arch of the foot, so it's important that we kind of strip those out. And I use the top of the foot to help stretch these things out as I'm working on it. And it doesn't take a lot of pressure. I don't have to put tons of pressure on the foot. As long as I know where I'm at and I'm on the right area, everything moves pretty well.